Welcome back. If you've only just joined us, you're watching the Daily Roundup with Nina, and we're discussing some health matters this evening. IntraHealth Namibia is a Namibian non-profit and a leading local partner in public health. It seeks to improve access to quality health services and information for communities and families in need throughout the country. Since inception, IntraHealth Namibia has implemented various projects with great success. This includes assisting the Ministry of Health and Social Services in applying the workload indicators of staffing need tool to the World Health Organization, as well as the redesign, development and rollout of an improved electronic patient management system, which is used to manage clients on antiretroviral therapy. Joining us this evening from IntraHealth to speak on the establishment's 10-year milestone and more is the General Manager, Lavinia Shikongo. Madam Lavinia, good evening and welcome.
Good evening.
Thank you so much for being here this evening.
Thank you for having me.
Talk to us about some of the programs to start with that you undertake and implement within the country.
So, as you have indicated earlier, we support the ministry and the government to implement some health programs, especially those that were quite pressing and urgent in the past few years: HIV/AIDS, TB. So we do implement and support with financial support from PEFA through USAID and CDC, implement programs aimed at obviously addressing issues of HIV, especially among the populations that are holding us back. As you know, as you might know, the country wants to be at 97
Correct.
by 2030, which means that we want to make sure that those who are HIV or are infected with HIV know their status, and those who know their status, those who are HIV positive are on treatment. 95% or 97% are on treatment, and those who are on treatment are viral load suppressed, meaning that they are not able to pass it on to the next person.
Undetectable.
Undetectable. You are very skilled on these issues. Yeah. So, and if it's undetectable, it's untransmittable, right? So we have been supporting the ministry to reach key populations, to reach adults and girls and young women, to reach pregnant and breastfeeding women, to reach men, because what we are finding is that health-seeking behaviors, as we all know, among men are not as good as they are among women.
Right.
So we are increasingly finding out that there are pockets of society that we need to reach if we really want to get to 97 by 2030. So IntraHealth has been supporting the government on that, especially the Ministry of Health.
In how many regions are the projects that you undertake, in assisting the Ministry of Health? In how many regions is IntraHealth present?
Okay, we are currently in 12 regions. So we have worked in 14 regions before. As you have mentioned, the electronic patient management system, ePMS Quantum, we have designed it, wrote it out in all the regions, but we are done with that now, and it's being managed by the ministry. And that was done with, again, PEPFAR support through USAID. So that was done throughout the country. But at the moment, we are in 12 regions of the country. We are not in Kunene, and we are not in Omsati at the moment. Yes.
As also mentioned, you're celebrating a milestone, 10 years of IntraHealth. Talk to us about, some of the key achievements of the organization over this past 10 years.
Yeah. So some people are asking, of course, 10 years, it's just 10 years. Some of us are 30 or 40. Why are you celebrating 10 years? But for us, it's a milestone. It's a milestone to also thank the government and especially the ministry for creating a conducive environment in which civil society organizations are able to provide support and implement activities, especially that reaches the hard to reach. So what have we done? Some of the milestones or some of our achievements you have already mentioned. We have supported the ministry in collaboration with WHO, and we support from USAID, financial support from USAID, to develop the Human Resources Strategic Plan 2020 to 2030, because it's very critical that we have the health workers where we need them, and when we need them, and they have the skills that they need in order to provide the services.
Correct.
So that is one of them. We have also then designed, rolled out, and trained data clerks, health information officers, and everybody who is involved in data on ePMS Quantum. So we have done that. Over the years between just 2019 and 2023, we were working under Project Hope on a project called Dreams, which is funded also by USAID, or was funded by USAID. And we have reached over 55,000 adults and girls and young women with health services, whether it's family planning, whether it's pre-exposure prophylaxis, whether it's HIV testing, whether it's HIV treatment, whether it's gender-based violence services, and so on and so on. So we have trained health workers to make sure that they treat everybody in this country, regardless of their status in society, with dignity, and they give them the services that they need. So we have done quite a lot over the years.
And I'm sure, of course, as much as there is a lot to celebrate within the 10 years, there's also been challenges. Talk to us about some of these challenges that NGOs generally face within this country.
Yeah. So the NGO sector, we mainly compete for funding. Yeah. We don't have set funding that come every April. Yeah, that we don't have.
Right.
So we have to apply for funding and hope that we get it. And our funding is also time limited. So one donor will give you 1 year worth of funding, one donor will give you 2 years worth of funding. And then there is what is called battles for talent. So we are trying to get the best that the market has to offer so that we can achieve on our targets.
This is in terms of healthcare professionals.
This healthcare professionals or any other professionals, right? So we compete for that. At the same time, not everybody wants to work for an organization that doesn't have unlimited funding.
Right.
So people say, you give me a contract for a year or 2 years. How do I get a mortgage from the bank? So we also have those challenges. But it's exciting. It's a great environment to work in. You make a contribution. You are contributing to the goals of your society. So those of you out there and have thought of joining civil society, please do. The other issue is obviously we are an upper middle class country. So we have very limited donor funding and it's drying up. So we are counting on our private sector to please come in and help us to deliver services to Namibians.
Madam Lavinia, we're almost out of time. So in closing, any last words you'd like to share with us on this 10-year milestone celebration that IntraHealth achieved? Yeah,
no, I mean, we are very excited. As I said, we want to thank our partners, our donors, and the government for creating a conducive environment. We started with 10 staff members. We are now at 240. And again, we would just like to appeal, especially to the private sector, Namibian private sector, to please come to the party and also support the interventions that we are implementing.
Well, thank you so much for being here this evening. It was lovely speaking to you.
Thank you so much. Thank you for having me.